doing the drug methotrexate. So the mechanism of action of methotrexate is due to its inhibition of enzymes which are responsible for nucleotide synthesis, including dihydrofolate reductase, amylase synthase, and aminophosphoramidine, etc. This prevents the nucleotide synthesis, which prevents cell division. Another potential mechanism by which methotrexate may diminish inflammation in the joint is by diminishing cytokine production. Numerous studies have demonstrated diminished levels of inflammatory cytokines in the serum of patients, and the adenosine receptor agonist, the CGS-21680, is a potent inhibitor of neutrophil leukotriene synthesis in vitro, and similarly, methotrexate therapy leads to diminished production of leukotriene before by neutrophils, which are stimulated ex vivo. And as you can see in figure 24.5, we see the chromosome separations during the anaphase in which the cytokines will be in the middle where the X chromosomes are at. So this is where we see the cytokines, and the same thing if we go to figure 24.9. We see the cytokines on figure A, right in the middle where they're, like, the anaphase is already trying to separate it. And also, a third proposed mechanism of action is based upon the observation that polyamines accumulate in the synovum of patients with RA, and that the metabolism of these polyamines by macrophages leads to the production of toxic oxygen products that diminish stimulated T cell function. An example is the rheumatoid arthritis methotrexate polyglutamates, which inhibit AI cart more than methotrexate. This inhibition leads to accumulation of AI cart ribonucleotide, which inhibits adenosine deaminase, leading to an accumulation of adenosine triphosphate and adenosine in the extracellular space. Because of its mechanism of action, malignant cells, as well as actively proliferating cells of the host, such as bone marrow, fetal cells, buccal and intestinal mucosa, and cells of the urinary bladder, are sensitive to the MTX phase. The methotrexate interferes with the inflammatory pathways. It is an analog that is used in the treatment of cancers, like, for example, it's acute lymphoblastic leukemia, non-Hodgkin lymphoma, and etc. There are two biochemical mechanisms by which methotrexate may moderate inflammation. One of them is promotion of adenosine release, and the second one is inhibition of transmethylation reactions. The result of several studies indicate that the methotrexate interferes with multiple inflammatory pathways thought to contribute to the RA. Methotrexate undergoes polyglutamation within the cells, and methotrexate and its polyglumates inhibit purine and pyrimidine synthesis, which reduce antigen-dependent T cell proliferation and promote release of adenosine, which also has anti-inflammatory activity. And as you can see right here on the picture on figure 2, we see the neutrophils, the pathway. This pathway is triggered by the TLRs and inflammatory cytokines such as TNF and the IL-1, leading to the activation. If we see that the normal versus cancer cells in a similar manner, the selective salvage of normal versus malignant cells with the use of nuclear rescue after high dose of methotrexate treatment, if possible, because of differential effects. With a lower metabolic rate of activity, it is possible, however, that the relative preservation of the therapeutic effects of methotrexate usually is observed after addition of either folic acid or ubiquinone. Also, the antifolic resistance might result from impaired cellular influx or increased efflux, impaired polycutimation, increased expression or mutation of cellular targets, or intracellular accumulations of the Th factors. Some side effects and causes of the methotrexate is out of 116 RA patients, 71 patients used methotrexate. The most frequent side effect was the gastrointestinal disturbance in 31%, following by central nervous system and 18%, hypotoxicity in 14%, and stomatitis and alcoholism 10% each. Gastrointestinal disturbances were the most common side effect, while lung involvement was the least. What causes these side effects is that the renal impairment was the most significant variable, increasing the risk of the side effects. Other associated variables were male gender, non-Saudi nationality, smoking, steroids, hypomelania, and the presence of extra articular manifestations. So how do these side effects relate to the drug mechanism? The mechanism of action regarding the efficacy and toxicity are probably determined by different metabolic pathways. Recent data indicate that the anti-inflammatory effect of the methotrexate is mediated by adenosine. However, methotrexate side effects can only be partly explained by folate antagonism and may also depend on its action on other related metabolic pathways. So approximately 30% of the patients abandon the treatment because of the drug-related side effects. So a question that I have is there a better drug besides methotrexate that can be able to target the gastrointestinal? And will it have better results? And here are my references. Thank you.